My name is Brittany Buffum, and I'm here today with Peggy Liuzzi. As former head teacher for Peace Head Start, former executive director of 20-plus years for Child Care Solutions, and current board member of New York State's Early Care and Learning Council, Peggy has long been a strong advocate for children. Over the last 3 decades, Peggy has played an integral role in the formation of child care programs and advocacy efforts across the state. More recently, Peggy has been recognized for her hard work, by which she was honored with the Alliance of Communities Transforming Syracuse Social Justice Leadership Award for Early Childhood Education, the New York State Women of Distinction Award, and the New York State Association for the Education of Young Children's Champion for Children Award. Peggy understands firsthand how critical it is for families to have access to high-quality childcare, but she has also experienced the multiple barriers families and advocates face in trying to secure these resources for families. Peggy, what has kept you to remain a champion of the cause and to stay so motivated over all these years?
It is just such a natural passion for me. I'm a mother, I'm a grandmother. I've worked in childcare, so I know what staff members and family childcare providers experience in the field. And I also know how powerful the impact of having access to high quality early education programs, the powerful impact it has on both families and on children now and in the future.
Yes, I agree with all of that. Thank you. How do you see those advocacy's effort, or how did you see those advocacy efforts shift over the years in regards to the approach and the legislative ask?
I am one of the things that I find disappointing is that despite all the decades that I've worked on this issue, and it's been probably close to 40 years, I have found that in some ways our advocacy goals have not changed very much. I mean, there has been an infusion of some additional funds, but in terms of availability of support for people who pay for childcare, I think our legislative agenda is not so different today than it was 10 years ago or 20 years ago. The affordability is still a factor that we really haven't had a strong impact on. And I think part of it is that it's not a state issue, it's really a national issue about financing childcare. The thing that we've had more success on is some of the quality initiatives. We certainly have come a long way since I started working in childcare in 1971. We've come a long way in terms of requirements for staff training, for background checks, for setting out standards that define quality. We have a beginning of a quality rating system in New York State. So all of those are things that have been advances. I guess the other thing that we have made little progress on is compensation for the childcare workforce. So that's an issue that is still as compelling today as it was decades ago.
Yes, I do bring up the compensation in a later question because I also find that troubling that we do not properly take care of the workers who take care of our children. Okay, great, thank you. As the longtime former executive director of Cayuga and Onondaga County's local child care and resource referral agency, you and your staff worked directly with the families that were most affected by the struggles associated with accessing quality child care. Over your tenure, what do you think was the most significant barriers for families in regards to accessibility?
I think that cost is the biggest barrier, but there are other barriers as well. For some families, transportation is an issue if they're dependent on public transportation. I've talked to parents who have had to take 2 buses or even 3 buses to make the progress from home to childcare to work. It is very difficult in a city like ours that has not a strong, the cities, upstate cities that don't have strong public transportation systems. And then another obstacle that comes up is for parents who need part-time care they work in non-traditional shifts. So they work evenings or weekends or overnight, or they have rotating shifts like you would in a hospital. Or in a lot of retail. That's very difficult to find childcare that is can be responsive to those scheduling needs.
Indeed. I mean, most of the demand with the job market now do have odd shifts. A lot of the lower paying jobs are on those non-traditional schedules, so it is difficult as well. Excuse me.
It affects, I think, entry-level workers more than those who have gone further in their field, because also if you worked more, perhaps you're in a better paying job, so you have your own car, you have some additional resources. But I think for families that are, um, I guess I'll call them the working poor, of which there are so many, that they're just their resources are so slim that anything that goes wrong can just throw the whole family off course in terms of their finances and their ability to continue in the workforce and provide for their children. So those are all very big obstacles. And I think that quality is sometimes an obstacle too. We've had parents who have had childcare situations, some of them informal childcare, some of them formal childcare situations that did not meet their children's needs, and it was very difficult for them to find a situation where they felt that their child was truly all their child's needs were being met in their childcare situation.
Yeah, there's definitely a lot of factors that play into that. Certainly, as you mentioned, the transportation issue and having to take 2, 3 buses. There's a lot of families that don't even live on a bus route, so then they're walking quite a ways as well. So there are a lot of obstacles for sure. And do you think that the main barriers that families face that you mentioned, have they primarily remained the same, or have you seen them shift as the cost has gone up? Has that been more of a barrier recently, or has it remained about the same, those barriers?
I think costs have gone up, and subsidies in almost every county in New York State are being rationed. So the availability of help to pay for childcare um, has remained just difficult. There are many families who don't get that help, and not in Cayuga or Onondaga County, but in some counties there are waiting lists. In some counties they've reduced the eligibility levels. So there are all kinds of issues around financial access, and I think the other issue that's been a factor over the most recent decade is that we've also lost childcare, regulated childcare in Onondaga County and Cayuga County, and I think across the state there's been a loss of regulated childcare because some of the centers, the small centers that were running churches and other facilities, they just haven't been able to survive financially. A lot of family child care providers, as the regulations have become more stringent, it's been more difficult for them to stay in the business.
Hmm.
They really have difficulty meeting all the regulations, and some of the family child care homes, they were really more like, I'm a loving person, I'm home anyway, I'll take care of kids. And the regulations now, I think, require somebody to have more of a business mindset. I'm in this business, I have paperwork I need to do. There are ways that I can make sure my home is compliant with the regulations because I'm savvy about taxes, but many providers have gone out of business because of chosen to go out of business because
Yeah,
of increased regulations. And those are the home-based providers. So
yeah,
that means that people may have to travel further to find a child care program.
yeah. So, as we mentioned, the costs of childcare have risen dramatically in recent years, yet childcare providers are some of the lowest paid workers across New York State. Do you think that this has a significant impact on the quality of care that parents are able to access?
Well, it does because when a workforce is low paid, it inevitably increases turnover. And that's an issue for child care providers who have to do screenings on their staff. They need to train their staff. They need to build a team that is in the centers. Everybody's on the same page. They share a philosophy. They share similar is when they're working with children, they have the same philosophy of working with parents. All of that takes time to build a strong team, and when there's turnover, it's constantly eroding those impacts. And the turnover, we've done a number of studies when I was at Child Care Solutions. Turnover is always highest in those jobs that have the lowest compensation. So
Yeah.
you'll see that turnover is so very high for teacher assistants and less high for head teachers, less high for directors. But when you compare it to turnover in school systems, you'll see just how very high it is compared to other professions. And it has an effect on the ability to have a quality program, but it also has an effect on children who bond with the people that care for them every day. They have very strong relationships. It's almost like extended family. And when someone they depend on and love leaves, it's very hard for children. They grieve, and it does have a cost, I think, in terms of relationships and children's emotional security.
I certainly agree with that. I have two young children that had very different experiences and dealt with that firsthand. Um, okay. Many individuals perceive the child care industry as a lucrative business, with the cost of care being so high, but that certainly is not so. According to CNN, New York State is the second most expensive state for child care. If the cost of care is so high and the child care workers are paid so little, where do you think all of this money is going?
Well, I get asked this question a lot. It's a very labor-intensive industry, and it's a highly regulated industry. And I think that both of those things support um, what's good for children, but they also raise the prices of the care. And you can look at states that have a much lower cost of child care, but when you look at the ratios, the number of children that an adult is allowed to care for, my hair stands on end because I'm not sure that those children can be safely cared for with those kinds of numbers, and certainly their emotional and learning needs can't be met when you have large classrooms and very few staff. And that's so quality actually does drive up the cost, and we want quality, but we want to find a way that we can help parents with the cost. We don't want to reduce the quality in order to make it more affordable, because that's really a devil's bargain in terms of the effect that would have on children, on their safety, and on their development. So it's challenging, and there are insurance costs are high. That's another issue that programs have to face, especially center-based. But again, having all of these safeguards in place, it means that parents can have peace of mind when they go to work and they leave their children in a child care program. Those regulations are a very important consumer protection, and again, very important for children's experiences.
Yeah, you raised some great points that I think a lot of people don't think about. They wouldn't have thought to think that deep into it, but it definitely affects the cost, and quality is the best. So sometimes you get what you pay for, not always, but it plays a role in this, certainly.
And the thing that drives the cost the most is what is paid to staff. And as I said, it's very labor intensive because many programs are open 12 hours a day. So they are not just, even if they have a ratio of one teacher for every 4 infants, for example, they're there for more than an 8-hour workday. So they have, perhaps an early morning assistant that comes in, and then the head teacher, another assistant comes in at the end of the day. So there's overlapping staffing, and staff need lunch breaks and other breaks. But children still need to be in a situation where there are adequate staff to supervise them and make sure that they're safe. So those costs really add up.
Yes, I agree.
And the programs, I think that more programs. When I first became active in the field, a lot of programs did pay right at the minimum wage, And now there are still um, some. There are some that do that, but more programs are saying if we're going to attract parents, we have to have qualified staff. We want people with a 2-year degree. We want people with a 4-year degree in the classroom, and we want them to stay. So for a program that's committed to quality, then they are going to pay more for staff. And we don't want to encourage them to pay less because they get the kind of stability and more experienced staff and more educated staff that are, again, going to support a high-quality program and good experiences for both parents and children.
Yeah, definitely. Going forward, the industry is sure to face new challenges, as we have seen with the new federal regulations in regards to the Child Care Development Block Grant that are about to be implemented. What are your recommendations for the new wave of advocates in order to shed new light on the issue of child care and early education?
I think that persistence is very important, and that we all, as advocates, should be in touch with our legislators and communicating through various community media all the time, all year long, not just during legislative season, so that we really can raise the understanding of the community of the importance that child care plays for families and employers. I think that our child care subsidies are one of the best employer supports that are available to businesses through through our tax system. It's a benefit that benefits families, but businesses, because it allows especially women to continue participation in the workforce, and it lowers absenteeism when there's good child care available. It promotes better productivity. It's not good just for children and families. It's good for business. It's good for communities. Those messages we need to get out all the time, and then maintain those relationships with legislators and with those who are in elected positions, county executives, mayors, our governor, and the federal legislators, which can seem like it's so far away that it's that we can't make a dent on it, but in fact, it's many federal decisions, including the changes in the regulations, are very significant to what happens at the local level for child care. And I support the regulatory changes, making child care safer and improving the quality, but there was very little money that was put behind it, and that's when local legislators are complaining about unfunded mandates, and all of those who make decisions about budgets and laws need to understand that these investments are very worthwhile. You can't have quality without making investments. We need a financial system that makes availability of high-quality programs something that families can access. And whether that's direct subsidies for low-income families or increased tax credits for middle-income families, all of these things are part of a network of supports that are needed to make child care work in the United States. So we just have to keep saying it, keep in touch, win allies, educate, and we do see change over time.
Yeah.
And there needs to be more of us putting forth these messages.
I agree, and I also agree that it's so critical to build that rapport with your legislators during the year because they're so busy that time of year in budget season. Everybody has an ask that time of year, so we need to make sure they know who we are year-round.
And their aides, too. I think their aides can be very helpful in terms of absorbing some of the details and being able to advise their principals on the direction to go in.
Yep. I do. So thank you so much for joining me today, Peggy. It has been a pleasure. The residents of New York State have certainly reaped the benefits of your hard work. And while you may be retired from your executive leadership position, your presence is still felt and voice of advocacy still resonates. Is there anything you would like to add?
No, I think I've said everything, but I thank you very much for interviewing me, and they were great questions, and it felt good to answer them.
Thanks.